All right. What is normal sinus rhythm? Sinus rhythm describes a cardiac impulse, again, that begins in the SA node and follows the natural path of progression down to the Purkinje fibers in the ventricles. The term normal is indicating that the impulse is occurring at a rate of 60 to 100 beats per minute. The reason for this is because this is the natural inherent rate of discharge at the SA node. Remember, we talked about that before. So, in order to understand deviations from normal, however, we first have to understand what normal is, or what it should be anyway. Now, in the next few images here, you're going to see rhythm cheat sheets as well as sample rhythm interpretations that we'll go ahead and work through together. All right. So first up here on the right, we've got a rhythm cheat sheet for normal sinus rhythm. Notice that the heart rate is in between 60 and 100 beats per minute, which is the normal inherent rate of discharge for the SA node. When we look at the regularity, it is regular. All of these P waves are marching out on time every time, as are the QRS complexes. Okay, so it's a regular rhythm. The P waves are all upright, and they also appear similar to one another. In addition, there's one P wave for each QRS complex. What this tells us is that for every beat that's initiated at the SA node, the ventricles picks this up in a one-to-one fashion. Okay, the PR interval is normal between 0.12 and 0.2 seconds, and it's constant. So this tells us that each beat is taking the same exact time to reach the ventricles. And finally, the QRS complex is less than or equal to 0.12 seconds, which is the normal range for the QRS. Remember, every time we see a narrow QRS, that tells us that the impulse is originating from above the ventricles. Okay, remember we talked about how the ventricular muscle is relatively thick and very slow to transmit and impulses and contract. When that impulse arrives, remember, on the fast track from the SA node or the atria above, we should always expect to see a nice tight QRS complex. Now, the only exception to this would be in the case of a bundle branch block, which we're not really going to get into in this video, but a little bit later on we might. So here on the next slide, we've got a sample rhythm interpretation that we'll follow along with using the concepts that we've discussed up to this point. Okay, so here we're working through our progression. This is the reason why we kind of laid that foundation earlier, right? Remember, RP and Q times 2, stat. That describes the process that we're going to work through for every rhythm that we break down together. So RP and Q times 2, rate, rhythm regularity, P waves, PR interval, QRS complex, QT interval,